Is that
Perfect.
working yet for you? Okay, good. Okay, whenever you're ready. So I just wanted to start by saying, for those of you that don't know me, my name is Stephanie McLane. I was diagnosed with lipedema in 2014. My journey, I don't think, is much different than anyone else's, really. I was a thin child always. I was always very active. I participated in sports and dance and cheerleading. I was a spinning instructor for many years. It really wasn't until the birth of my twins in 2002 that I noticed that there were some changes with my body, and I really didn't know what was happening. So I want to say it was after a Google search of, painful legs, fat legs, all of those things that I think everyone kind of Googles before they come to us or their providers. And that's when I learned about lipedema. So why does my fat hurt? I believe was exactly what I was Googling at the time. And upon that, I stumbled across lipedema. What is lipedema? Why do I have this? What do I do about it? I ended up finding some groups on Facebook, mainly the Lipedema Sisters group that I joined. And that's where I learned about Dr. Stutz in Germany, who does the wall procedure for lipedema. I learned of Dr. Herbst and all sorts of conservative treatments, supplements, diet, exercise, compression, all of that. So through the Lipedema Sisters Facebook group, I met a woman who's semi-local to me. Her name is Laura. She and I became very close, and she encouraged me to go to Arizona to see Dr. Herbst to get my diagnosis. So that is what I did. And it was, I believe, somewhere in the fall of 2014 that I did go to Arizona, and I met with Dr. Herbst, and she diagnosed me with lipedema in 90% of my body, as well as diffuse Derkham's disease and Ehlers-Danlos syndrome. I'd like to say that I was relieved when I got my diagnosis, but it was actually quite the opposite. Incredibly overwhelmed, scared, what the heck do I do? How do I stop this? Why did I get this? Those were the questions that, I struggled with. And I know that most of, the rest of our patients and everyone else that has lipedema sort of does the same thing, because most of our providers and primary care physicians don't even know what it is or haven't even heard of it. So that was a struggle that I had faced. After my diagnosis, even after I saw Dr. Herbst and came home, it was, okay, well, now what? So that's when, at that time, I did consult with a surgeon, I think two surgeons that performed liposuction for lipedema. And I believe the second one that I saw quoted me for the 4 procedures that I was going to need $56,000, because they didn't participate with insurance, and that was, for me, just not an option at all, which sort of, makes the whole, I have lipedema and I need the surgery and my insurance isn't going to pay for it, and I don't have $56,000, to pay out of pocket for these procedures that I needed, really played on me mentally for a long time. I struggled with depression. It was difficult. And thankfully, at that time, my friend Laura, that I met through the Lipedema Sisters Facebook group, put me in touch with Dr. Shapira. At that time, Dr. Shapira was a friend of hers, and she knew that he was training to start treating lipedema. I had learned that he had gone to Germany a few times and had trained with Dr. Stutz. And so I contacted his office, and I do believe I had my first appointment with him in December of 2014. So it wasn't long after my diagnosis, thank goodness, that I was able to start, getting the help that I needed. So when I met with Doc, he, confirmed my diagnosis. We tried to come up with, a plan to move forward. But the one thing that sort of set Dr. Shapira apart from, the other doctors that I had consulted was that he did not feel that it would be, ethical, or it wasn't right for me to have to pay $56,000 or anything really out of pocket for these procedures that were medically necessary. So we had to come up with a plan of how to prove to my insurance company, that this was not a cosmetic procedure. So Dr. Shapira and I spent a lot of time talking about what that process might look like. So we compiled a list of things that we thought would work. And I would like to, say that I believe I was one of the first women in the United States that did actually get approval for the wall procedure. So we submitted to my insurance company, and I was approved upon the first submission, which was really awesome. It doesn't happen often. It does still happen sometimes, but it's usually a fight. And but I was approved, which was great. So I went forward and had my 4 wall procedures. I believe I started in February of 2015. And it was great. I immediately after my first procedure experienced a lot of the relief from the pain that I was having in my knees, and just in my legs in general. Felt so much better. And, Dr. Shapira and I kept in very close contact through my recovery. We spoke every day. He followed me very closely to see, how I was healing and how I was recovering, and, what changes were happening. So it was after I believe my 3rd or 4th procedure that Dr. Shapira, decided that he wanted to open his practice to offer these services to the rest of the community. So in, talking with him about that is sort of how I decided to come on board and be his patient care coordinator. So that's kind of what brings us to where we are now. I have been working with Dr. Shapira since 2015, so it's been about 5 years now. And, that was the start of my journey. So I'd like to just go a little bit, fast forward now to, what the process is in our office to becoming a patient. So I recommend each patient to, reach out either on our website, or you can email me. I have my email up on the screen. My direct line is there. Once, you make the initial contact, I can send you our new patient intake packet. The packet is pretty large. We do take like a very thorough medical history. You'll submit your photos. And, once all of that information is received from the patient, we would go forward and set up your consultation with Dr. Shapira. We do offer 2 types of appointments. Obviously, an in-office consultation is always preferred, but we realize most of our patients, live at a distance, and, traveling to Delaware isn't always an option. So we do offer a telemedicine appointment, which I believe a very large portion of our patients do for the first time. So that's really great. So during your initial consultation, Dr. Shapira would review your medical history. He does a very thorough intake and would discuss your lipedema symptoms. It would be like at that point, usually based on, the answers to, whatever questions he might have for you during that time, he would determine whether or not he thinks you are a candidate for the wall surgery. If he does, he puts together what we call a to-do list for each patient. And this list varies a little bit patient to patient, not too much, but we really like to take like a holistic approach to treating our patients. So it's not really just a drive-through surgery where you come in and have your surgery and you're done and then that's the end of it. We really like to make sure that you're optimizing all of your conservative treatments first, following a proper diet and exercise protocol, because since, we don't really know what the mechanism is that causes lipedema in the first place, we like to have all of our patients, in the best physical shape that they can be so that they can get the best outcome from their procedure. So that to-do list, typically consists of all the, optimizing the conservative treatments, sometimes an evaluation by a lymphedema therapist or an orthopedic surgeon, an orthopedic surgeon, because a lot of our patients have joint issues. We would talk to you about diet and, whatever kind of exercise that you might be capable of doing at that time, and starting some supplements if you haven't already. Dr. Shapira also likes to work very closely with your other physicians. So he doesn't like to be the only physician making the determination that you should have surgery, especially in the situation where we would be submitting, pre-certification requests to your insurance company, because we like to be able to prove medical necessity. So we always work very closely with your other providers. So with that said, we do recommend that you get a copy of your insurance plan. A lot of times, they can outline whether or not liposuction is a covered procedure. 99.9% of the time it's not. So we like, it's always good to have a copy of your plan so you can see exactly what those stipulations might be. And again, we really have to work hard on proving medical necessity. And their to-do list would also include some things like gathering some letters of medical necessity from your other providers, which are very important, as we discussed. And I've also found that having each patient write her own Lipedema Bio is helpful. This is basically a letter, I guess, that you write to your insurance company, explaining to them, what your lipedema symptoms are, how it affects your daily life, what you can do or what you were able to do prior to your diagnosis or before your symptoms progressed, that you can no longer do now, and really kind of spell out how your disease affects your activities of daily living. That's very important. So once we have received all of the information that Dr. Shapira puts on your to-do list, is at that time we would submit to your insurance company. So the loaded question that we always get is, will my insurance company approve this? Will it be denied? How long is this going to take? And these are all the loaded questions that I wish we had answers to, but unfortunately, it's not always that easy. So we would at that time, submit to your insurance company, and we have some insurance companies that make their decision right away, either within a few days, a week or so, but then there are others that can take their time. We kind of don't really know what that looks like until we get there. So this is where the process becomes a little tedious. Dr. Shapira and the rest of our staff spend so much time on each patient, working with the insurance company, doing peer-to-peer reviews and, going back and forth. It's a lot of work on our end, but thankfully most of our patients do get approved. So that's great. So then we come up with the question of, what do we do if I'm approved? So the good news is, obviously, if you're approved, we put you on this, on the schedule, we move forward, great. But oftentimes, the process starts with a denial. It's not uncommon. It happens all the time. It's something that we're used to. And, oftentimes Dr. Shapira can schedule a peer-to-peer review with the insurance company and, has been very successful in getting them to overturn those denials. Other times that still doesn't work and we have to appeal. The appeals process is, again, a very lengthy process. Each patient has the option to appeal on their own, or our office can do it for you. We do have all sorts of materials that we would send in with an appeal package, all of your medical records, your letters of medical necessity, anything that was submitted upon, that we had submitted previously, for the approval request. And, so oftentimes, we do get approvals after an appeal. Sometimes, unfortunately, the appeals get denied and then they have to go to an external appeal or review. And, so basically the bottom line is we always say, don't take no for an answer. You know, your insurance company wouldn't tell you that you shouldn't have your gallbladder removed because it's not medically necessary. So we don't really like to look at, you know, your well procedures for lipedema any differently. So never take no for an answer. So you're approved. Let's say, you know, we're going to move forward and you want to be prepared for your procedure. The most important thing that I feel each of us really needs to focus on is having realistic expectations. The wall procedure is most definitely not a drive-through procedure. It's surgery. Surgery's trauma. You know, you really need to be prepared physically and mentally for, you know, what your recovery is going to look like. And it's different for everybody. You know, myself, I sit at a desk all day long. So after my, you know, procedures, I took 3 or 4 days off and was able to return to work without an issue as long as I elevated my legs and walked. But we have other patients that don't. It really depends on, you know, your age, the stage of your disease, your genetics. You know, there's all sorts of things that can affect that. So having realistic expectations is really important, as well as I like to tell everyone to please try to stop comparing yourself to others. I know this is super hard. I do it too. We all do it. I think a lot of times as women, we get very caught up in, you know, what am I going to look like? I don't want to look like this anymore. You know, I saw pictures of another woman and, you know, she looks great after her surgery, and that's great. And we do expect some sort of, you know, cosmetic improvement after the procedures, but it's not the main goal. So, you know, I really just like that everyone, you know, have realistic expectations. And if you're not ready to move forward, then don't, because, you know, like I said, you really have to be prepared to go through the changes that you're going to endure during a procedure like this. And most of our patients need more than one. So, you know, a full treatment, you know, if a patient needs, you know, 3 or 4 procedures, could be 6 months or to a year. So it's a lot. So I just like everyone to be prepared for what's to come, you know, and what to expect afterwards. So, you know, make sure that you have support from, you know, your spouse or your friends, family members, children, you know, because you're going to need that too. It is, like I said, not a drive-through procedure, so you will be sore. Some patients, you know, the recoveries are tougher than others. I mean, I've had one of them in particular that I struggled with more so than the rest, which is normal. So, you know, you just want to make sure that you are prepared for all of that. Prior to your procedure, something that Dr. Shapira and I speak a lot about is making sure that you get plenty of rest the day before your procedure. You know, if you show up stressed or tense and nervous, which is normal, you know, Dr. Shapira can always give you something for that, you know, to take a prescription, you know, prior to the procedure. But it's really important that you, as, you know, yourself, make sure that you're in a good place to move forward. You want to be well rested and ready. And the other thing, the last thing really, you know, the advice that I can give anyone is just to be kind to yourself. This disease is awful. I mean, I get it. I've been there. I have it. I deal with it too. Recovery can be difficult. It's not horrible, but, you know, first couple days are tough. Your body goes through so many changes, especially afterwards. Many patients can expect, you know, like a surge of emotions all over the place, which is, you know, what we believe to be, you know, the release of hormones that have been just, you know, stored in the diseased fat for a very long time. So just be kind to yourself, be patient, reach it, you know, make sure you have support from your family, keep close in touch with your doctor. I'm here, that's what I'm here for. If there's ever any questions, you know, after your procedure, you know, don't hesitate to reach out to me for those as well. So, and that's all that I have. I hope that I covered everything. I'm going to be on for the rest of the webinar to answer any questions at the end. So I'm going to pass it back to Larry. Thank you.